Let's go to the section 4 of our lecture topic, malignant diseases, and in this we will talk about the malignant disease of the vulva. And in this we will talk about the stages and prognosis, spread, symptoms and signs of the malignancy of the vulva, and pre-malignant conditions of the vulva. Malignant disease of the vulva is the squamous cell carcinoma, malignant melanoma, basal cell carcinoma, and adenocarcinoma. So all these are the different malignancies of the vulva. Squamous cell, malignant melanoma, basal cell, and adenocarcinoma. The clinical presentation here, if you see in this diagram also, there is a lump or ulcer or growth in the vulva. So lump or ulcer with bleeding or discharge that may or may not be painful. So bleeding, discharge, or maybe or may not be painful. Stages and prognosis of vulvar cancer. Stage 1, usually the tumor is confined to vulva. In 1A, lesion is less than or equal to 2 centimeter, and invasion is less than or equal to 1 millimeter. In 1B, lesion now is more than 2 centimeter and invasion is more than 1 millimeter. So again, size 2 is in 1 and 1A and 1B, the main difference is 2 centimeter lesion. In 1A is less than 2 centimeter, 1B is more than 2 centimeter. Then in stage 2, tumor of any size with extension to adjacent perineal structures. Now in stage 2, no matter what's the size, it is now extended to the adjacent structures. 1/3 lower urethra, 1/3 lower vagina or anus. Then stage 3, tumor of any size with or without extension to adjacent perineal structure. Stage 3A is with 1 lymph node metastasis, 3B is with 2 or more lymph nodes, 3C with positive nodes with extracapsular spread. So 3 is mainly, now it spreads to the lymph nodes, and once it reaches the lymph node through the lymphatic system, it spreads to the different parts of the body. Stage 4, tumor invade regional or distant structures like 4A, upper urethra, vaginal mucosa, rectal mucosa, or fixed to pelvic bone. 4B, any distant metastasis including pelvic lymph nodes. So these are the 4 stages of vulval cancer. Again, as with any other cancer, diagnosis in the early stage when tumor is small, confined to the vulva, not deeply invaded, that's the good prognostic cancer. As the staging process, as the tumor spread and as it becomes more invasive, the prognosis become poorer and poorer. Spread of the vulval cancer, can be due to direct spread, which occurs to the urethra, vagina, rectum, and pelvic bones. Other is lymphatic spread. The lymphatic spread is by embolization, and at late stage, the spread is by permeation to fill the lymphatic channels. Lymph nodes are involved, so once the lymph nodes are involved, it can spread through lymphatic flow to the different parts, and it can permeation also occur. The spread by permeation to fill the lymphatic channels. So depth of stromal invasion and groin lymph nodes involvement and in squamous cell carcinoma of vulva. So what's the depth of invasion? If it's less than 1 millimeter, usually lymph nodes are not involved. If the depth of invasion is 1 to 2 millimeter, 7.5% nodes are involved. 2.1 to 3, 10%. From 3.1 to 5, 30%. So depending on the invasion, depth of invasion of the carcinoma, the involvement of the lymph nodes is associated with that. Once the more and more lymph nodes are involved, the spread or metastasis is rapid, and it can rapidly progress to the fourth stage or the late stage cancer. Now the symptoms are, patient might be asymptomatic, having no symptoms at all. Pruritus is present. Pruritus is the itching. Pruritus vulvae is the itching of the vulva. Swelling with offensive discharge, difficulty in urination, inguinal mass, vulval ulceration, bleeding. All these are the symptoms that are associated with malignancy of the vulva. Signs are usually there is on examination there is vulval ulcer or mass is present. The ulcer has a sloughing base with raised, everted and irregular edges, and it bleeds to touch. So it's very fragile, raised edges, and it bleeds when it is touched. Surrounding tissue may be edematous and indurated, and associated vulval lesions may be present. In this diagram, you can see the involvement of the nodes and spread. In the stage 4, again, there is spread to the organs, and there is extensive hematogenous and lymphatic spread also. Inguinal lymph nodes of one or both the sides may be enlarged or palpable. So signs of the vulval malignancy, there is presence of ulcer, there is presence of edema and induration, there may be involvement or swelling of the lymph nodes are present usually, and a patient, the ulcer or growth is, it bleeds easily on touching. Investigations are usually the gynecological oncology, depending on the team of the doctors when they come together and make a team, and what they decide how the investigations should be done. That's important. Biopsy, chest X-ray, MRI, and CT scan of the thorax, abdomen, and pelvis. So biopsy, CT, MRI, and all the other investigations depending on the doctor's team. Premalignant condition of the vulva. 3 premalignant conditions of the vulva we will discuss here in this section, and what are the symptoms and how they present. So in the first, we have the vulval intraepithelial neoplasia. That's the etiology of intraepithelial neoplasia is usually infection with human papilloma virus. Characteristics of this is usually leukoplakic erythematous or pigmented lesions. Leukoplakia, white lesions. Erythematous, red or pigmented lesions. Symptoms, patient present with itching, or it may be asymptomatic. Treatment is surgical excision, laser treatment, and some creams are also used for the lesion. Risk of malignancy that they might go to malignancy is 10%. May be higher if the patient has low immune system. So first condition, vulval intraepithelial neoplasia. Next is the lichen sclerosis. The cause is unknown. Patient characteristics is there is leukoplakia of vulval skin in figure 8. There is leuko is white. Leukoplakia in figure 8 is present, and there is loss of architecture or the shape of the vulva. Patient again with irritation or asymptomatic, steroid creams are used. Treatment to become malignant is 10% chance of malignancy. Then we have extra mammary Paget's disease of vulva, again cause not known. It is well demarcated erythematous lesion. So it's red lesion as compared to previous two, which are leukoplakia is present. In this, there is redness is present. There is itching, irritation, or patient might be asymptomatic. Surgical excision aiming for white margin of healthy skin. The excision is done including the margin, including the healthy margin to avoid the chances of recurrence. And then the risk is again 10%, and it increased to 30% in case of other malignancies present. So these are three very common pre-malignant conditions of the vulva that can ultimately lead to vulval malignancies. So that was all about the malignancies of the vulva. Thank you for watching sqadia.com.